And Social Welfare, the Minister of Information and Communication, the Secretary General of the Republic of the Gambia, the Chairman and members of the Presidential Task Force on AKI Inquiry, Chairman Medicines Control Agency, the Solicitor General, the Government Spokesperson, the Chief Medical Director, Edward Francis Small Teaching Hospital, Chairman and members of the AKI Victims Association, the bereaved families, the representative of the WHO, the Permanent Secretary, Minister of Health, and other government officials here present, media personnel here present. I would like to take this opportunity to welcome you all to this gathering, whereby we would like to update the bereaved families and the whole nation on the acute kidney injury outbreak in the Gambia, and to provide the findings of the various investigations. I want to first and foremost extend the condolences of His Excellency, the President, Mr. Adam Barrow, and his entire government to the bereaved families whose children are no longer with us today. May Allah grant them Al-Jannatul Firdaus and give you the fortitude to bear the loss. Acute kidney injury is a sudden onset of deteriorating function of the kidneys, which manifests as oliguria, diminished urination, or anuria, that's absent urination, and other symptoms such as edema, confusion, nausea, vomiting, diarrhea, shortness of breath, coma, etc. This is because the kidneys are damaged and unable to maintain the internal milieu of the body, leading to accumulation of toxic products of metabolism, which becomes fatal in some cases. Acute kidney injury has many causes. Among these are Escherichia coli infection, severe dehydration, which might be as a result of diarrhea and vomiting, nephrotoxic drugs and substances, malaria, etc. Background on the outbreak. On the 26th of July 2022, the Ministry of Health was alerted on the increasing number of children presenting at the Edward Francis Small Teaching Hospital, and many of these children succumbing to their disease. The Epidemiology and Disease Control Unit of the Ministry was instructed to swing into action to get to the root of the problem. The World Health Organization, WHO, was contacted for support in handling the outbreak. An incident management system was set up to manage the situation. The incident management team was co-chaired by the Minister of Health and the WHO. The membership comprised of an experienced team from the Ministry of Health and its various units and directorates, Medicines Control Agency, that's MCA, representatives of the partner institutions like WHO, UNICEF, Center for Disease Control, CDC, in Atlanta, Georgia, doctors from the Edward Francis Small Teaching Hospital, etc. Extensive deliberations took place in the committee meetings, and the AKI response decisions came from this committee. Various WHO experts, including the Regional Emergency Director for Africa, the Incident Manager for Africa, came to the country and participated in the incident management deliberations. Since the phenomenon was unprecedented in this country, it was very difficult to ascertain at first what was causing the acute kidney injury, AKI. The committee suspected that the AKI could be caused by drug toxicity, since paracetamol toxicity was identified as a cause of AKI in some countries in the past. The World Health Organization country office helped to send patient samples and samples of drugs used by these patients to laboratories in Senegal, Ghana, France, and Switzerland. In the meantime, doctors noticed a convincing trend in the occurrence and worsening of the disease in some of the children on consuming certain drugs. The Ministry of Health decided to ban these drugs even before receiving the confirmation from the laboratory testing. This led to the press release instituting the ban on the consumption of paracetamol syrup in the country on the 7th September 2022. This was later followed by a ban on promethazine syrup on the 10th September 2022. The ministry imposed these bans despite criticisms and complaints from some people at that time that we were banning drugs without conclusive evidence. During this time, some patients continued to receive treatment at Edward Francis Small Teaching Hospital, while some families opted to travel to Senegal for further treatment. The government and partners put our efforts together to provide needed materials, including hemodialysis equipment for the children and other drugs and medical items. This involved an enormous commitment from the health workers in the hospital in providing care for the patients and in the field carrying out surveillance activities. The laboratory analysis confirmed that toxic levels of ethylene glycol, EG, and diethylene glycol, DEG, were found in 4 syrups, namely promethazine oral solution, BP, cofexmalin baby cough syrup, Macof baby cough syrup, and Maghrib cold syrup. DEG and EG are organic compounds that are found in certain products such as industrial solvents and antifreeze, and are used as raw materials in manufacturing polymers. Accidental or intentional ingestion of DEG and EG products has been known to cause poisoning. Illegal use of DEG to replace glycerin or propylene glycol as a solvent in medications has been reported in some countries in the past. All 4 of these products were manufactured by Maiden Pharmaceuticals in India and were imported to the Gambia by Atlantic Pharmaceuticals. Government immediately banned Atlantic Pharmaceuticals, who got their license withdrawn and their premises closed. This was followed by police investigation into their activities. The Medicines Control Agency sprang into action with a series of steps to remove the drugs from circulation. These steps included a ban on the sale and consumption of all Maiden pharmaceutical products in the Gambia. This was followed by a recall of these products from the drug outlets and households. The outbreak was controlled by November 2022 after the products were removed from circulation. We have never lost sight of the fact that sadly 70 children died as a result of the outbreak. The AKI outbreak was a national tragedy. This was a very difficult moment for all of us, and we wish to emphasize to the bereaved families, His Excellency's President Barrow's resolve and that of his government to addressing this issue. However, it was very important to establish the cause of the acute kidney injury in a scientific way. At the request of the Minister of Health to the World Health Organization, WHO, a causality assessment committee, CAC, was set up comprising of both local and international experts. His Excellency, the President, also established a task force to inquire into the death of children as a result of consumption of contaminated medicines imported into the country from India that is suspected to cause acute kidney injury. The National Assembly also set up an inquiry into the AKI deaths, and their report was also presented to the Minister of Health for action. The Minister of Health, in collaboration with the WHO, conducted a thorough epidemiological investigation entitled Acute Kidney Injury Outbreak among Children in the Gambia from June to September 2022, an outbreak investigation report. This was submitted to the Minister of Health and was intended to corroborate or refute findings of the causality assessment. The causality assessment. The causality assessment team worked closely with the Gambian Ministry of Health, MOH, the Medicines Control Agency, MCA, and the Epidemiology and Disease Control Unit to come up with the most plausible causal association that led to the AKI. In short, the CAC concluded that the outbreak of AKI in children in the Gambia was attributable to medicines contaminated with DEG and EG. DEG or EG. In addition to reviewing the laboratory evidence, the Causality Assessment Committee found that the clinical presentation in these children was highly consistent with DEG or EG poisoning in previous outbreaks. However, the cessation of the outbreak after the suspected pediatric syrups were withdrawn strongly suggested that poisoning rather than other causes was behind the AKI deaths. The conclusion of the CAC are consistent with the conclusion made by other bodies investigating the matter, including the WHO. The task force, presidential task force. After reviewing the findings of the causality assessment report and conducting a series of interviews and reviewing numerous documents, the presidential task force made a series of findings and recommendations, a few of which will be highlighted today, since we are going to launch the report shortly. First, the task force confirmed that the deaths can be conclusively linked to the 4 cough syrups imported by Atlantic Pharmaceuticals from Maiden Pharmaceuticals in India. The task force also investigated how these syrups were imported from India and distributed in the country. They learned that the affected medicines were not registered with the Medicines Control Agency, even though the regulation requires all medicines to be registered before importation. The MCA has the legal responsibility to ensure all medicines and related products are submitted through an application for registration prior to importation. The task force found that there is an urgent need for a quality control laboratory to conduct proper testing on all medicines and related products imported into the country. Although the statute authorized a national laboratory years ago, the MOH failed to establish the national laboratory. One of the fundamental requirements of registration is that an applicant must submit a copy of a certificate of a qualified pharmacist, and that failure to submit the requirement will render the application invalid. All licensed importers with the Medicines Control Agency are expected to have met the aforementioned requirements. The requirement of the law is that the licensed pharmacist will serve as the supervising pharmacist, working for or with the importers to provide professional advice to the importer during the process of importation and distribution of the medicines and related products. The task force indicated that Sheikh Kebbeh, serving as a supervising pharmacist for Atlantic Pharmaceuticals Company Limited, admitted to signing off the importation of the 4 cough and cold syrups, later found to be contaminated. According to the task force, Mr. Kebbeh only provided technical advice for the procurement and importation of the medicines, but did not do any background check on the manufacturer. Recommendations of the task force. The task force came up with some recommendations for implementation by government. Some of these recommendations are in progress and will be highlighted. We will highlight a few today. 1. The government of the Gambia should ensure that the MOH urgently facilitates the establishment of a fully operational medicines quality control laboratory as mandated by the Act. The response is that the World Bank is helping the government of the Gambia in establishing a food and drug quality laboratory in Busubi. The architectural design and the development of the bill of quantities is currently going on, and the construction work will start soon thereafter. Government has already tasked MCA to get support from partners. This is already ongoing with support from the WHO and the Pakistani Drug Regulatory Authority. This step will continue and will be enhanced. The MCA should establish a fully functional pharmacovigilance department to include a medicine safety expert committee, regional hospital monitoring and investigation teams, and focal persons at the regional health directorates and health facilities as required by the regulation. The response is MCA has already started this process, and MCA is instructed to ensure the expansion of the scope to increase coverage and efficiency. 3, MCA should recruit students who have graduated from UTG in biochemistry, chemistry, and biological sciences to strengthen its human resource capacity. The response is MCA is being instructed to act on this. Number 4, the government of the Gambia should refer the matter of Sheikh Kebbeh, the supervising pharmacist for Atlantic Pharmacy, to the Pharmacy Council for appropriate disciplinary action. The response is that the matter of Sheikh Kebbeh will be immediately referred to the Pharmacy Council for appropriate disciplinary action. Number 5, the government, through the Pharmacy Council, Ministry of Higher Education, Research, Science and Technology, and the University of the Gambia should prioritize the establishment of a school of pharmacy at the University of the Gambia to meet the growing demand for pharmacists in the country. The response is this process has started, and advertisement for the recruitment of consultants for the curriculum development will soon be out. This initial phase is being funded by the World Bank. Preliminary discussions in this line have also been held with the World Health Organization Director General, which will be followed up urgently. Other possibilities with other partners and potential partners will be explored. Recommendation number 6, the government of the Gambia to permanently revoke the importation license issued to Atlantic Pharmacy Company Limited and their directors. The response is the license of Atlantic Pharmacy Company Limited has been permanently revoked. Number 7, the government of the Gambia through the MOH should review the laws and regulations surrounding granting importation license and instill stringent conditions so as to ensure that importers are approved based on their qualifications, operating with a sense of accountability and responsibility rather than being principally driven by profit. The response is the Ministry of Health has retained an experienced law firm that is currently carrying out a review of all health-related legislation in the Gambia. This will be carried out as part of our ongoing review of the acts under the Ministry of Health. Number 8, recommendation 8, the government of the Gambia should with immediate effect dismiss the executive director and deputy executive director and consider prosecuting them in line with the relevant laws for their abdication of their official duties. The response to that recommendation, considering the foregoing, for the purpose of strengthening the MCA and restoration of public confidence in the institution, the executive director of MCA has been dismissed with immediate effect, and also the contract of the deputy executive director is terminated with immediate effect. The report will also be forthwith transmitted to the Gambia Police for further action. Recommendation number 9, the government of the Gambia through the Ministry of Justice and Ministry of Foreign Affairs should forthwith explore the possibility of instituting further legal action against Atlantic Pharmaceuticals and Maiden Pharmaceuticals, and should engage with the government of India to seek criminal and civil redress on behalf of families of the victims of the AKI outbreak. The response to that recommendation is the government is far advanced in exploring avenues for potential legal action against Atlantic Pharmaceuticals and Maiden Pharmaceuticals, as well as potential redress through engagement with the government of India. The government of the Gambia is currently benefiting from legal advice from a top-tier legal law firm that will support us in carrying out this. Following this press briefing, copies of the entire report will be released to the public. That is the Presidential Task Force Review report. And at this juncture, we hereby release the Presidential Task Force report for the public. Copies will be circulated to you by the government spokesperson. In addition, for better understanding of the concepts and the analysis of establishing a causal relationship between the contaminated medications and the development of acute kidney injury, we will equally release the causality assessment report carried out by the World Health Organization in collaboration with the Ministry of Health. To further analyze the causal relationship, to dig into the issue by going back into the communities where the children hailed from, it was important to also carry out an epidemiological review in a case control study format to correspond each case of AKI to a control in the community. The Ministry of Health asked the WHO to support in conducting a survey, which survey is intended to either corroborate the findings of the causality committee and then or to refute the findings of the causality committee. And this is the survey called Acute Kidney Injury Outbreak Among Children in the Gambia, June to September 2020, an outbreak investigation. And this will also be released to the public for proper review. And this has also corroborated the findings of the causality committee, which was also taken into consideration by the Presidential Task Force in coming up with their findings and recommendations. We want all to note that the government of President Adama Barrow will continue to engage the international community, our community, local community at large, the bereaved families, the victims association, to continue working together to deal with the acute kidney injury outbreak. We wish to thank the Presidential Task Force, the chairman, and all the membership for the hard work, commitment, and all the sacrifice to ensure that this report, this investigation is carried out and this report is put together, advising government on the next steps with regards to acute kidney injury. We thank you very much. We equally want to thank our partners